We are now live streaming.
Thank you. Right, well, good afternoon, everyone. Welcome to this session about the Napier Barracks Reception Centre. The panel this afternoon to answer your questions is myself as the leader of Folkestone and Hyde District Council, Damien Collins, the MP for Folkestone and Hyde, Councillor Roger Gough, leader of Kent County Council, Sean Palmer, Director for Resettlement, Asylum Support and Integration from the Home Office, Chief Inspector Alice Ames from Folkestone and Hyde District Commander, and Alison Dougal, Acting Director of Public Health, Kent County Council, along with Steve Lakey, Managing Director of Clear Springs Ready Homes Limited, who manage the site, and Helen Bransfield, Director of Asylum Services, Migrant Help. So welcome to your panel. I will now pass over to our MP, Damien Collins, for an introduction.
Thank you very much, David, and I'm grateful to you and to Roger Gough at the County Council for joining this meeting and for the District Council for hosting it. It's good as well that we have representation from the Home Office and other agencies that have been involved with the running of this site at Napier Barracks. As many people will know, this was a decision that was taken by the Home Office. It's not a decision that I supported, and I know the District Council have consistently raised their concerns about the suitability of such a large facility at Napier Barracks in close proximity to a large residential community, and with all the inherent problems of accommodating so many people on one site during the pandemic. I think the concerns we raised at the beginning have been slightly borne out by what has happened, and we certainly want this to be a temporary arrangement, and it's certainly my preference that Napier Barracks should be closed as soon as possible, as soon as the residents there can have their cases assessed, and I would hope that this temporary arrangement would come to an end in September, which is the end of the 12-month lease that the Home Office has taken out on the site. But of course, we look forward to hearing more from the Home Office about their intentions on that. I know Sean from the Home Office will be able to speak from their part. I would just like to thank, though, the officers at Folkestone and Hyde District Council in particular, and the Public Health and Kent County Council for all of their hard work on this site. Although this was not a decision that was taken locally, it wasn't a decision initiated by the local councils, it's absolutely right that our duty is to do the best to manage the situation in the best possible way for the sake of our residents and those who are accommodated at Napier. And I'd like to thank the Home Office as well, because they've been very open to working with our local councils. And indeed, the Home Secretary herself, who's spoken directly to myself and David Monk and the Chief Executive of the District Council to hear directly from us our feedback on how the operation of the site was going and to feed in directly our concerns. So whilst this was not a policy decision that we initiated or supported, I'm grateful that everyone has managed to work well to try and make the best of this situation.
Thank you, Damien. Can I now ask Roger, the leader of Kent County Council?
Thank you very much, David. And I'll just echo what Damien Collins just said. I think the perspective of all the local representatives, so David as Folkestone and Hyde District Council lead, myself as leader of the County Council, Damien as the Member of Parliament, is that this was not a decision that was generated locally. And we have, in a sense, two roles. One is that we will always continue to represent the concerns, both in terms of local community and indeed any professional concerns that we have through the roles we play on this. At the same time, we seek to work with our colleagues in the Home Office to ensure that, as Damien said, the situation is managed in the best interests both of those who are staying at Napier Barracks and of the local community. Just a word about the County Council's role in all this. Alison Dougal, our Director of Public Health, is on this panel, and it is through our public health responsibilities in particular that we have a significant role in this. And in particular, this is providing assurance and indeed, where necessary, challenge in relation to the suitability of the site, the arrangements on the site, And this in particular, of course, relates to some of the concerns that were mentioned in relation to health concerns and COVID, among others. We also have responsibilities under what's called Section 42 of the Care Act in relation to vulnerable adults who are on the site and seeking to ensure that any of those who are in need of that sort of help are able to access it. We played a very active role along with our colleagues in the District Council and with Damien and others, particularly at the time when we saw the most severe situation at Napier back in the earlier part of the year, when we had first the disturbances and then indeed the outbreak in that, and were deeply involved in how all of that was managed and brought back under control. Understanding at the moment is that there are no COVID concerns in terms of any outbreaks on the site, and Alison indeed can speak about that in more detail. It's worth saying finally that from the County Council's point of view, of course, we have a range of responsibilities which emerge in different ways vis-a-vis migration. You will often hear us speak about unaccompanied asylum seeking children, and historically that was the group of migrants, when migrants arrive in Kent, who actually stay within the county. Until Napier was opened, all other adults or families moved to other parts of the country under asylum dispersal. And it was partly under the impact last year of COVID and with, in effect, the gumming up of the dispersal system nationally that the use of Napier came into being. So we remain absolutely concerned both to represent, as I say, the views of local residents and the concerns in all directions, and there are a variety of views, I know, of local residents, but also to discharge the responsibilities that we have to ensure that there is good public health and that the mechanisms which the Home Office put into place in Napier are discharged effectively. David, I'll leave it at that.
Thank you, Roger. Now we pass over to the man in the hot seat, Sean Palmer from the Home Office. Sean.
Thank you very much. And I'd like to start with a very big thank you both to the district and the county council, but also the people of Folkestone and Hythe for their support, engagement and challenge in our operation of Napier. I'm really grateful for the way that people have worked with us to make sure that Napier is running the best possible way. I'm really grateful to the people of Folkestone and Hythe. We've seen an enormous number of people volunteer with charities and with community groups, or make donations to service users to ensure that they have the best possible time while they stay at Napier. I've just finished my introductory remarks with just commenting that Napier has been a really important part of the response that the Home Office and indeed the UK has made to the challenges that we've had with the asylum system during the pandemic. Ministers made a number of decisions during the pandemic in order to provide more accommodation to people to protect public health of communities. And that increased the number of people that we supported and accommodated. And therefore we had to increase the number of sites, the number of properties that we used to accommodate people, and have extensively used contingency accommodation across the UK. Napier is part of that solution and part of how we've solved that problem. And I'm really grateful for everyone that's been involved in this for their participation in it. Thank you.
Thank you, Sean. Now we come to the questions for the public. First of all, I'd like to thank everybody who has submitted a question. We grouped them into actually 5 themes, and different people will respond to those. Every question that was put to us, however, will be given a written answer in a Q&A, which will be posted on the council's website in due course. Okay, so we come now to the first question, use of Napier. The questions are the length of time the site will be in use and occupancy limits. The site deemed not fit for purpose, could another site be found? And similar army camps in Wales was deemed unsuitable and closed. Sean, could you respond to those 3 questions, please?
Yes, of course, and I'll take them in that order. So first of all, just to recap, the site was brought into use last September as a result of the pressures placed upon the asylum system because of the pandemic, to ensure there's sufficient property and accommodation available to people. Although that pressure has gradually reduced, and we're working very hard with our providers and with local authorities up and down the UK to bring on more regular accommodation, the pressure still exists, and we still are using contingency accommodation in higher numbers than we would want to. We have an agreement with the Ministry of Defence to use the site until September 2021. And September 2021 is also the period for which we've got emergency planning permission to use the site. If we wanted to use the site beyond that, that would involve us having conversations with the Ministry of Justice and with the local planning authority. We haven't had any of those conversations. Service users at the moment spend between 60 and 90 days at the site, and we're using it very much as a first short-term part of the accommodation solution, and we're keen to move people through the site relatively quickly to keep that going. And we've reduced the overall capacity of the site to just over 330 people to allow us to have spare capacity on site so that we can self-isolate people if there are any infectious disease outbreaks, which would include, of course, COVID. Moving to the second question, as I've said, the purpose of the site is to serve as short-term accommodation for healthy men, and we're using it in that way. We're taking care to allocate service users to Napier using the suitability criteria that we've set out and are using to make sure that we only provide accommodation there where it's suitable to do so. Over the last few months, and with thanks to Alison and Public Health Kent and others, we have made a series of improvements to the management of the site to manage public health risks, but also to generally improve the operation of the site. And Steve may come on to this a little bit later in one of the follow-up questions. Throughout the setup of the site, we've engaged extensively with various statutory authorities and others to ensure that we're keeping up to date with guidance and best practice wherever we can. We have acknowledged that dormitory style accommodation is not the preferred approach from Public Health England, and we've taken steps where we can to mitigate the risks of using dormitory accommodation, and I'll set that out a little bit later. I'll set out, I know there's further questions on lessons that we've learned from the COVID outbreak earlier in the year. So moving to the third question around the site in Wales, which was Penally. So the site in Wales was different to Napier in a number of respects in terms of the accommodation that was available, the location of it, and so on and so forth. And so it's not directly comparable. The biggest difference in the decision to carry on using Napier and not to carry on using Penally was the planning situation is different between England and Wales. So whereas we've got emergency planning for Napier for 12 months until September, in Wales, the emergency planning only lasted 6 months to March. At that time, ministers decided that they would cease to use Penally, but reviewed and decided to continue to use Napier for the time being. So I hope that answers those three questions. Thank you.
Thank you, Sean. We now come on to the second set of questions, which was about site security, and they are concerns about litter in the area surrounding the site. And would this council impose a public space protection order a la Quince, broken glass disregarded, food, etc.? And thirdly, the concern following recent issues requiring emergency services attending site. I shall answer the first two questions and then ask Steve to answer the third. So in response to the first, concerns about the litter and the public space protection order, there is currently a public space protection order covering the Cheriton and Shorncliffe areas, and this includes parks and public spaces in the vicinity of the barracks. The area in question is patrolled regularly and treated as a hotspot. We do want our parks and public spaces to be kept clean for everybody to enjoy. Through the district's community safety partnership, our officers work with colleagues from local policing and other partner organisations to ensure that crime and antisocial behaviour is addressed whenever possible. When antisocial behaviour or littering is witnessed by officers, action is taken, and this can result in a fixed penalty notice being served. It is very helpful if members of the public report antisocial behaviour, as this helps to highlight the types of issues occurring, identifies areas for our officers to patrol, and provides evidence to support action. Specifically in relation to litter, the council works hard to ensure that litter is cleared as much as possible, but I urge all park users to be responsible and either place litter in the bins provided or indeed take it home to dispose of. Residents are encouraged to report litter problems through the council's website. I'll now move on to the third part concerning the access of emergency service to Steve Lakey. Steve.
Thank you. In terms of the question, we work very closely with local emergency services and they're engaged directly with on-site management teams, as well as being part of a wider strategic partnership group. As with any other group of human beings living together, there will be issues that need to be dealt with, and they may involve the emergency services. However, recent incidents have thankfully been very minimal and relate very much to individual cases that have all been successfully addressed. The emergency services, as I said, work very closely with us, and they have had an on-site day as an introduction to everybody, and we have regular meetings with them. That, coupled with communication with the residents on site on a regular basis, help to keep those incidents to a minimum.
Thank you, Steve. Right, when we come on to the third, which was community safety, and there was concern about an event advertised by Evenbright trying to get coaches to come down to protest. And secondly, COVID, what lessons have been learned after the recent outbreak? I should first ask Alice Ames to respond to the concern about the event, and then ask Sean to follow up with lessons learned. Thank you. Alice, please.
Good afternoon, Leader. Thank you for the invitation to join me this afternoon. If it's all right, I'll first address around the actual incident on Saturday, the advertised event, and then I'll move on to just make a general comment around community safety.
Thank you.
So we were aware about there was a potential demonstration that was due to take place last Saturday on the 17th of May. We'll always respond in a proportionate manner to any sort of peaceful protest and encouraging everyone there to comply with COVID legislation. We do ask that those that are planning or attending any protest to consider this, and we absolutely urge the organiser of any event such as this to speak to us beforehand, then we can establish how it might have an impact on the wider community and also offer advice. From May the 17th, the government eased restrictions on protests and the numbers attending them. So it does mean that they are allowed to proceed. However, as I mentioned, organisers of planned gatherings do have that responsibility for ensuring the safety of those attending and compliance with the current rules designed to prevent the spread of COVID-19. Failure to do so can result in fines. With regards to this particular event last Saturday, officers did attend, but no enforcement action was required on that occasion. With regards to community safety as a whole, with Napier as a force, Kent Police have remained committed to that visible local policing. I'm sure many of those viewing and online will have seen officers out and about in the community, and we have increased our presence around the area of Cheriton. And that is absolutely as part of our dedication to keeping everybody safe, those on the site and in the community around it during that lockdown. Inspector Andy Brittington is my lead for the site, and he is the inspector of our community safety unit. That unit is there to be a visible and reassuring presence in our communities. So we do support the site management team whenever necessary. We engage with service users at the site regularly. And importantly, we listen to everybody. We always want to listen carefully to the local community and residents and hear your concerns. I see our role as building positive relationships and I think everybody should be treated with fairness, respect and dignity. I absolutely respect that people who have different views, but please be assured that we will and we have taken action against anybody that commits crime in the area. Having said that, I do also want to take the opportunity to reassure from the last engagement session when we were looking forward, having it just landed, now we can look back and see how it has impacted our community, and there's been very little change to any local crime rate in that community. So I hope this offers some reassurance for how well we've been working with our partners. But of course, community safety isn't just about the police, and we work closely with colleagues from all the different agencies that comprise the Community Safety Partnership and with other organisations, including charities. But it is really important about the role of the wider community to work together collectively to reduce that crime and keep everybody safe, particularly those who are most vulnerable. In particular, with regards to hate crime and extremism, we again work closely with partners, and I do recognise there's been a rise in online hate within our community. Working with those partners, one example was the support and training provided recently to schools in the area regarding via the Prevent Education Officer. This was aimed to support children and young people from any online hate, extremism, fake news, and also to support parents and carers to make the internet a safe place too. I'd like to remind everybody that there's lots of ways that we can be contacted if there's any concerns. Via our online tool on our website, we offer a lot of online surgeries, meetings, and via our PCSOs in the community. And obviously via 101 if you have any other concerns. I hope that addresses your question, Leader.
Thank you very much. It does indeed. Can I now go over to Sean? This, I think, is a quite broad-ranging one. And if anybody else has anything to add at the end of it, I'll be pleased to hear from COVID lessons learned from the recent outbreak.
Thank you. Yes, I think we've learned an enormous amount from the operation of the site over the last few months, including the outbreak that occurred through January and February of early this year. One of the biggest learning points for me and one of the most positive aspects to come out of it is the closer working relationships that we've built across various organisations between the Home Office, Clear Springs, and various health agencies and organisations that have really helped us to understand what the risks are and to mitigate them in a better way. We've participated in a number of lessons learned exercises that have helped us to put better processes in place. To talk to some of the specific things that we've done, we've ensured that the signage around the site is better, so that people are better able to socially distance, and we've enhanced how we induct service users on site so that they understand more about how to be COVID safe on the site. We've implemented cohorting and staggered meal time, so there's less social interaction between different groups on the site. And we have reduced the overall numbers of people on site, so there is more accommodation available to allow people to self-isolate if they're showing symptoms or testing positive. On testing, we've introduced twice weekly lateral flow testing for all staff and service users that live on site. We also have lateral flow testing for anyone that visits the site on entry. We have worked really hard with Clear Springs and with public health colleagues to get a better outbreak management plan and an outbreak control plan in place so that we have clear procedures and processes in place for us should an outbreak occur, but also in running the site to avoid an outbreak from taking hold. So those are a few of the things that we've done, and overall I think we are in a stronger position with better controls in place now than we've had before. I hope that helps.
Thank you, Sean. Does anybody else want to add to that on that specific lessons learned? If not, I think we covered it elsewhere, but just in case. Okay, then we'll move on to item 4, which is the health and well-being of service users, well-being of residents and their mental health support, safety of residents against protest racism, conditions at barracks, i.e. lack of nutrition, risk of asbestos, integration of Napier residents into the community. Now I'm going to ask Steve Lakey to respond first, and then ask Helen Bransfield, and then Alison Dougal respond. Okay, so Steve, could you start with those?
Thank you, Leader. On the first point, in terms of wellbeing of residents and mental health support, we are fortunate to have an excellent on-site nurse who's linked in to the local health teams, and any resident who presents as unwell will initially be referred to the on-site nurse, who will then be able to refer them on for any community mental health support or any other medical support that's required. Any resident who no longer meets the assessment criteria for being at Napier will then be transferred from site under our safeguarding referral mechanisms. And the site has a very well documented safeguarding set of measures and processes, and referral routes are in place both locally and also internally into the Home Office safeguarding teams as well. All of the team on site are trained in safeguarding and how to spot and report safeguarding issues and make the appropriate safeguarding referrals. In terms of the safety of residents against protests and racism, residents are always put on notice of any protests by staff on site. We conduct regular risk reviews, and they're undertaken in partnership with police colleagues and other stakeholders and partners in terms of intelligence sharing and also managing upcoming events as we become aware of them. So it's very much a joined up approach, and it's applied at each event to make sure that everyone remains safe. In terms of conditions at the barracks, let me start with the food. We have brought on a new on-site chef and catering team who are committed to developing and working with stakeholders and also working with the residents on site to develop multicultural and varied menus to keep the food interesting and culturally appropriate for everybody. And all of the menus and all of the meals have been assessed by an independent nutritionist who has provided us with the nutritionist advice we need for those menus, and they meet the required standards. We also have a feedback mechanism in place with residents on site so that they can provide us with regular feedback on food and nutrition issues. All health and safety matters, from fire safety risk assessments to asbestos registers and asbestos management plans, are in place on site. They're managed by suitably trained staff, and we also deal with those issues in liaison with the relevant statutory organisations, both locally and nationally. In terms of integration of Napier into the community, that can't happen without the excellent work, and a huge thank you from us at Clear Springs for both statutory and voluntary sector organisations and partners who have really helped us to make sure that integration work can happen both on site and outside in the community. It really makes sure that we're able to engage effectively with residents on site. We can provide the support, and we can make sure that people are integrated, albeit temporarily, whilst they are on site within the local community. We've seen the setting up of community-based events by local support groups, by charities, and by local faith groups as well. And this, coupled with having migrant help on site to assist in the support and the coordination of activities, has really made a difference to make sure that the integration can happen effectively on site.
Thank you, Steve. Can I now ask Helen to comment on those four, please?
Yeah, I mean, it is so important for the well-being of the clients to be able to interact with and integrate into the community. It is a bit more difficult because Napier is short-term accommodation, and then we've had the COVID restrictions as well. But the clients on site are able to come and go as they wish, and they have been able to take part in community activities. We received so many lovely offers from local organisations, groups, and also national charities who were so keen to engage and support the asylum seekers in Napier. And we're really, really grateful for their help. And in fact, some of them go regularly into Napier to meet the clients on a weekly basis. We also co-funded the community support workers roles so that we had a presence on site. so they can help the clients directly. They've also coordinated the kind offers. We've had such amazing donations come in, and the clients have really benefited. So I'd like to say thank you to the local community. It has been a very positive experience. And by the way that the community's interacted, it means that the clients are more comfortable in the community as well. So thank you.
Thank you for that. Now, Alison, would you like to add to that, please?
Thank you. So, as already been mentioned, we've been working with Home Office around COVID security, looking at risk assessments, looking at the outbreak management plans, and they have definitely moved on, but a definite improvement there. We're also working with Home Office around the screening for the residents of Napier Barracks. So that's around the screening before they arrive at the barracks, to ensure that we've thought about their physical well-being, but also their mental health. So both physical and mental health are covered. Certainly, where we have had instances where we've had people that have had infestations or other communicable diseases, we're very happy that that has been taken care of. And we have really good links into primary care now. One of the things that we are starting to look at is dental care. And so I'll update it at a future meeting around that. But we're looking at the provision of dental care for the residents at Napier. And that's it from me. Thank you.
Thank you, Alison. Right, now there were a lot of general questions about the asylum process. So I'm going to ask Sean to respond in general terms about the asylum process. Sean?
Thank you very much. So on the general asylum process and illegal crossings, I would probably refer everyone to the recent consultation paper that the Home Secretary announced. The consultation closed earlier this month, but you can still view it online. So it's called the New Plan for Immigration, that sets out a series of proposals for how ministers want to reform the asylum system over the next period. I would also refer people to the speech that the Home Secretary made earlier this week, which is available online, that gives more information. The Home Secretary and ministers are really clear that illegal crossings need to be stopped, and they're working very closely with the French government and others to detect and prevent people from crossing the channel. There's a range of changes that are proposed in the new plan for immigration to fix the asylum system, but there's also a number of short-term steps that the Home Office is taking, again working with a range of other bodies to prevent illegal crossings from happening.
Thank you. I see there's a bit about reports of residents purchasing alcohol at supermarkets. I've got to say that providing that they are of legal age, there is nothing we could do to stop them purchasing alcohol. It's just they are legally allowed to. As we're now coming to the close at the end of those questions. As I say, all of the questions submitted will have an answer on our website. I would now like to just ask a couple of people to sum up for us. First of all, our MP, Damien Collins. Damien.
Thank you very much. Thank you for everyone's participation in answering those questions, and particularly for the District Council as well for organising the meeting and ensuring there will be written responses on the website as well. I just wanted actually, in closing, just a couple of questions coming out of the points that were made. I think it might be helpful if it's possible to address them now. I don't know, Sean, whether you could tell us, just with relation to COVID testing, are all the service users tested for COVID before they first come to the barracks? And are all for each migrant crossing, is everyone tested when they arrive in the country as well? And this is something that I've had a lot of people raise with me and their correspondence about Napier.
Okay, I'll go to Sean to answer that as he sums up at the end. I've got Roger next, and then Sean.
Thank you, David. Just to draw, I think a couple of the points that have emerged very much from what I hope is a helpful discussion that we've had relates to two things. Firstly, the importance, I think, that for those of us as local bodies that have very specific responsibilities, that we are discharging those and through that seeking to make whatever happens at Napier work better. And I think that was drawn out very much in Sean's comment about the work done with Alison and our public health side, and equally very much with the district council. But in terms of particularly public health, addressing some of the issues that arose so significantly from the outbreak earlier in the year and driving real improvements. So I think one important function that the local bodies have, in addition to, as I said earlier on, representing the concerns and the interests of the local community, is to ensure that these services are delivered in such a way that Napier operates as effectively as it can, both for those who are staying there and, as I say, in the wider interests of the local community. I was very struck by some of the comments from Helen about the local community's own engagement on this. So I think that's an important side of this. And finally, I think just draw attention again to some of the comments that Sean made, and I touched on it in my opening remarks too, as to seeing the context in which the use of Napier arose, which is very much around seeking to make a national dispersal system operate under conditions of a pandemic and the challenges around that, and therefore the use of what's called contingency accommodation. I would say that I hope that it will always be borne in mind as to the fact that Kent, and particularly East Kent, is a port area. It does receive large numbers of arrivals, including those who are migrants. Many of those, as I mentioned earlier on, do not actually stay in Kent. They move on into other parts of the dispersal system. But we do retain both the County Council's responsibility for unaccompanied children, and of course, we now have this situation here in Napier. But I very much hope that whatever is done on Napier in the future will bear in mind not only the overall position of national migration policy and the attempts to make all that work, but also the very specific circumstances of this county, and particularly of East Kent.
Thank you, Roger. Right, Sean, could you sum up for us and perhaps answer the questions Damien put?
Yes, so Mr. Collins' questions on testing, both on arrival in the UK and on arrival in Napier, so I can answer those both positively. So that yes, testing does happen at both of those points, and as I said before, lateral flow testing will happen twice a week for service users accommodated at Napier and staff. So there is quite a lot of COVID testing going on there. I suppose I'd just like to sum up in the same way as I started, with kind of a very big thank you both to the community of East Kent and Folkestone and Hythe, but also to both councils and to all of their staff and statutory bodies in the area for all of the support, challenge and engagement that we've had so far. It is really appreciated, so thank you.
Thank you for that, Sean. Well, that just about wraps it all up for this session. I would remind anybody that has any further questions that they should be submitted direct to the Home Office site, which you can find on our website. Very happy to pass them on. With that, I say thank you all.